Fibroids after 50, or more specifically, in the postmenopause. Do those fibroids still cause symptoms? Yes, they definitely can. Usually, those fibroids are symptomatic, meaning causing problems before you go through menopause. But what happens when you go through menopause is that the hormonal stimulation to those fibroids now is much less, almost non-existent. That's why fibroids will standardly shrink or decrease in size after menopause. Will they disappear? Usually medium to larger fibroids will not disappear. And if you happen to wish to take hormone replacement and you do take hormones, what will happen is those fibroids will grow to a certain extent and then hopefully just stabilize out. But do those fibroids ever become symptomatic again? In other words, they were not symptomatic at the time of menopause, but they later on, can they become symptomatic? The answer is that can actually happen. It's counterintuitive, but the body will become more sensitive in time to foreign bodies like uterine fibroid tumors, and symptoms can develop after longer periods, even 5 to 10 years, of no symptoms at all, in the absence of fibroid growth. So that's an issue for women in the postmenopausal years, and that is not very well recognized in the gynecologic literature at all. How do we know this? Because patients come in and report this regularly because they have watched their fibroids for a long, long time. And then they become symptomatic after years of not having symptoms. So it's a difficult question, but if you have fibroids after age 50 or after menopause, they should be monitored. And if you develop any symptoms that you think may be due to fibroids, it's always important to discuss that with your gynecologist.